Now to follow up, Brooke Army Medical Center, or BAMC, has a long history of treating civilian patients, as it is one of two trauma centers right here in San Antonio. But once patients are able to receive that life-saving care after, some of them face yet another problem, paying for it.
And now many South Texas families who are struggling with medical debt from Brooke Army Medical Center could soon get some relief. I-Team reporter Jay Avila has been bringing attention to this issue for years. He joins us now with the latest on an amendment that would pause medical bills for civilians.
Mandy and Jonathan, Congressman Joaquin Castro has written a couple of amendments to the National Defense Authorization Act. Both of them, if passed, would relieve financial strain for patients who've been billed by BAMC and the Department of Defense.
BAMC provides life-saving care for military and civilian patients, but its payment system doesn't work well with insurance companies, causing delays and late fees. Some patients get hit with huge past-due bills long after their treatment. If approved, one of the amendments would require the Department of Defense to pause collections on civilian patients, even those treated in the past. The other amendment would exempt patients from paying income tax on their debt if it is forgiven. Castro says civilian patients should receive this debt relief because Army doctors at BAMC benefit by practicing battlefield trauma skills on those patients.
We have learned there's a big exception to this, however. If a patient's debt is very old and has already passed on to the U.S. Treasury Department for collection, well, those bills would not be covered by the amendments. If approved, the amendments would take effect in fiscal year 2025. For the News 4 I-Team, I'm Jay Avila.